Why is Marsh classification crucial for celiac disease diagnosis? Imagine trying to solve a puzzle where each piece reveals a part of the story about your health. That's what a biopsy does for celiac disease. It looks at tiny samples from your small intestine to see how much damage gluten has caused. Now, the way doctors interpret these samples is key, and that's where the Marsh classification comes in. The Marsh system is a way for pathologists to measure how much your small intestine has been affected. It looks at the villi, which are tiny finger-like projections that help absorb nutrients. When you have celiac disease, these villi can become damaged, flattened, or even disappear. The Marsh classification assigns a number to these changes, from 0 to 3, to show how severe the damage is. A Marsh 0 means your intestine looks normal, with healthy villi. Marsh 1 shows an increase in immune cells inside the lining, but the villi are still fine. Marsh 2 adds crypt hyperplasia, which means the glands in your intestine are enlarged, but the villi remains intact. From Marsh 3, the damage gets worse. Marsh 3A shows mild villus atrophy, while Marsh 3B has more significant atrophy. Marsh 3C is the most severe, with complete loss of villi, leaving the lining flat. Doctors usually look for a Marsh 3 or higher to confirm celiac disease. That level of damage clearly indicates gluten has triggered a serious immune response. Lower stages might suggest early or less typical changes, but they are not enough for a firm diagnosis. Using the Marsh system helps ensure everyone's biopsy results are interpreted consistently, no matter where they are. This classification also helps distinguish celiac disease from other conditions that can cause similar symptoms but don't damage the small intestine in the same way. It guides doctors in making accurate diagnoses, which is essential for effective management. For those living gluten-free, understanding why a biopsy and Marsh classification matter can make the process less confusing. It shows why avoiding gluten is so important to prevent further damage and improve nutrient absorption. In short, Marsh classification provides a clear, standardized way to measure intestinal damage. It helps doctors decide if someone has celiac disease and how severe it is. This information is vital for planning treatment and guiding patients on how strict they need to be with their gluten-free lifestyle.